Hello, our lovely audiences watching this video. Welcome to yet another episode of the medical talk show brought to you by Vividus Hospital, where we talk about various issues regarding the health of the mother, newborn, babies, and children. Today with us we have Dr. Shanthala, who is a senior obstetrician and gynecologist practicing right here at Vividus Hospital. Thank you so much, ma'am, for giving us your time.
Hi, Shruti.
So today we're going to talk about at-risk or high-risk pregnancies as it's called, and I'd love to know more about this as to what constitutes a high-risk pregnancies, or if you have to define it, how would you define this?
In very, very simple terms, a high risk pregnancy is one which will impact the health of the mother and or the child. So that it's a sort of a red flag, it's an alert for us that this pregnancy needs to be supervised more than the others. So when we say high risk pregnancy, naturally there is that question, is there a low risk pregnancy? Of course there is, because pregnancy as such, we will never say, no obstetrician will say pregnancy is no risk, simply because pregnancy is one condition where there is a human being growing inside another human being. So it's not like being normal. So every pregnancy, most all pregnancies are low risk pregnancies if they don't have any high risk factors. So when we pick up any condition that might impact the health of the mother or the baby or both of them, then we classify it as a high risk pregnancy. And it's also very important that a pregnancy can begin as a low risk pregnancy, and as the pregnancy progresses, if the patient develops, if the mother develops hypertension or diabetes, or the baby is not growing as much as we expect it to grow, then we have to reclassify it as a high risk pregnancy. So in other words, it's not like at a one time you don't say, okay, we cannot classify a pregnancy in the beginning itself, at least all pregnancies, as high risk. So as we go on examining and supervising the pregnancy, they may shift from the low risk to the high risk. And saying high risk pregnancy is actually alerting the healthcare professionals, saying that this is a patient who needs more care than a normal low risk pregnancy.
Right. So you did mention about high risk and low risk. I just want to know out of curiosity that if if a woman is termed as a high risk pregnancy, with proper treatment, does it then change into a normal a low risk pregnancy before her delivery?
No, it's not that high risk can become low risk. It's just that the high risk has to be managed in such a way that the risk does not impact as much on the mother or the baby.
Right.
Or we reduce the impact of the risk. For example, if there is hypertension or diabetes in a pregnancy, so just by treating the hypertension, we can sort of keep the blood pressure under control. That is all. But it is having its impact on the baby also. So just because the blood pressure of the mother has come down, we don't say that it is low risk. Now we want to see what is that blood pressure doing on the baby.
Right.
So it doesn't just shift from high risk to low risk. Probably it is controlled risk. We control the condition. We can say that.
So, what causes high risk pregnancies? What is the cause?
So the many causes for high risk pregnancies. For the medical persons, we classify it as maternal causes, that is, and fetal causes. Fetal means babies, or it could be a combined cause. So maternal causes, again, many causes may be modifiable causes, like the weight of the mother. So every mother has an optimal weight, for which it is very low risk when they get pregnant. So if somebody is very heavy or somebody is very light, again they get classified as the high risk pregnancy. So the weight of the pregnancy is a modifiable factor, whereas the age of the mother is a non-modifiable factor. So someone getting pregnant at 37, they can't go back and become 25, isn't it? So at 37, the risk of pregnancy is definitely more than what it was at 23 or 24 or 25. So the age of the mother, the weight of the mother is also important. as well as any pre-existing medical conditions. So already if the mother is having diabetes or hypertension, or if she's having any cardiac diseases, or if she's a patient with renal disease, they are all the medical conditions that can impact the pregnancy, and therefore the moment we see them, we classify them as high risk pregnancies. And factors of the previous pregnancy that might impact this pregnancy, like somebody who's had a preterm birth, that is, see, the total duration of pregnancy is 40 weeks. So anything less than 37 weeks is preterm. So someone who has delivered a baby at 33 weeks, 34 weeks, 35 weeks, those patients might have an increased chance of delivering the baby early in this pregnancy. Similarly, a small baby, she had a small baby in previous pregnancy, she might deliver. Similarly, if she's had a cesarean section in the previous pregnancy, so it's not like a someone who is delivered normally, so she also gets grouped under high risk pregnancy. So and if someone has got a recurrent pregnancy loss, previously she's had miscarriages, or the baby she's lost her baby for whatever reason. So all of them get categorized as high risk pregnancies simply because we have to keep them under greater surveillance. Similarly, a twin pregnancy, mothers, that is the fetal factors, a twin pregnancy. So it's not like a singleton pregnancy. So we have to give more attention. Sometimes the factors may be combined, both mother and also the child. Mother may be having hypertension, so the baby may not be growing well. And now in this current situation where the assisted reproductive techniques are on the rise, so IVF pregnancies or the test tube babies, they also get classified as high risk pregnancies, because all the medical conditions like hypertension, diabetes are more in these patients, or they may have a preterm delivery, so they also get classified as high risk pregnancies. So whatever the cause, whether it is the maternal cause or the fetal cause or a combined cause, it is a red flag for the doctor that we have to care for this patient more than ever, more than the low risk pregnancies.
Right. So, what influences the outcomes of high risk pregnancies?
See, it's not, see, we have not, it's, delivering babies is not something new. This has been happening from times immemorial. They had the village attendants, the dowlers delivering, so they have the midwives delivering, so the grannies delivered by themselves, they just went to the washroom and delivered. So then what sets aside modern obstetrics from that? It is just this very fact that it is, we identify the risks. So the outcome of pregnancy, you might have seen our grandmothers delivered 10 or 12 babies, out of which they lost about 6 or 7 of them. So we cannot allow that in modern day obstetrics. So we cannot go to the plan B or plan C for any case. So we have to arrest it at the initial level itself. So the outcome therefore is very much dependent on recognizing the risk, number one, and also being able to tell the patient should understand that there is a risk. Thirdly, the patient should also understand risk does not mean something bad is going to happen. Risk means the doctor will take care of you better to ensure you have the best outcome. And finally, it's very important where the baby is delivered, because as I told you, a preterm baby or a baby whose weight is not optimal, they all need specialized care. So it's very important that they need care with the neonatologist. So we are very happy to say that at Vividus we have those facilities. So it's not just that the obstetrician is very adept at dealing with high risk pregnancies. We need a team effort. We need the neonatologist. So when we deliver the baby, we might just deliver the baby and say baby is not doing well inside. So when it comes out, it has to do well outside. So that kind of facility is very important. So all these factors matter a lot in optimizing the outcome for high risk pregnancies.
So, can you outline the management of high risk pregnancies?
So, management of high risk pregnancy, first of all, identifying a high risk pregnancy. As I told you, every visit that the patient comes, we have to assess the risk. So if she continues to be in low risk, we are also very happy. And if the risk is stepped up to high risk, then we increase the surveillance. As I told you, management includes the diagnosis. So we have to diagnose and categorize this as a high risk. Secondly, the investigations that need to be done. Apart from the routine investigations that is done, these patients may need other extra investigations, like if we detect that she's anemic, so we may want to know what is the cause of anemia. In our country, it is most often iron deficiency anemia. And as we were speaking the other time, there may be thalassemia minor or the thalassemia major. Patient usually comes with that diagnosis, and we know. But thalassemia minor is most often missed. Okay, where the patient is always having at the borderline anemia, 10 grams, like that. So but then we can't classify it as a majorly high risk pregnancy if all other things are normal. So those investigations need to be done. If she's a diabetic, we may ask for blood tests more frequently. We may ask for home monitoring of these patients. Similarly, hypertension, we may start her on medicines, and we may see something. Again, hypertension in pregnancy is a huge thing. So we need to see whether it's mild, moderate, or severe kind of hypertension. So the management therefore depends on the what is the cause of high risk. And most often, as I told you, they may need more tests, more antenatal visits. We may ask them to come back more. And most importantly, scan. See, present obstetrics, we can assess the baby by doing the ultrasound. So we can assess the growth of the baby, we can assess the blood flow to the baby by Doppler. So these are all methods that are called as fetal surveillance. See, the word surveillance is used. That means we are seeing how the baby is doing inside. So the scans, a Doppler test, and then we also tell the mother to keep a kick count, how much the baby is moving, and something like a biophysical profile. That is, as we do the scan, we want to know whether the baby is doing well. So we have certain parameters. The baby may just be moving, but then it may not have the power. So whether the baby is moving with lot of power, baby is breathing, we see how much of water that plays a very important role. The liquor, what we say, the water around the baby, we assess all that on scan. So the baby is kept under surveillance. Just like our cameras that we have for surveillance, we keep on watching the baby if the baby is doing well or not well. So the moment we feel the baby is not doing that well, then we decide and deliver. And even here, suppose the baby is too premature, maybe less than about 34 weeks, and we need to deliver baby because it's not growing or mother's BP is high, then we also give some medications so that it helps the baby. Like, we say antenatal steroids. By giving steroid injection to the mother, we hope that the baby's lungs develop. So all mothers, this we can do prophylactically also. Suppose mother has delivered early, previous pregnancy, preterm, and this time also she has a chance of preterm. So we give them prophylactic steroids, so that we hope that when she delivers, at least the baby's lungs are good. So by giving these steroids, we are ensuring that the lung development is there. These babies who have been given steroids will have lesser ICU stay. They'll have better neurodevelopment, leukomalacia, what we call, of the brain. That incidence is reduced, and respiratory distress of the newborn, that is reduced, and also it helps reducing the infection in the baby. So all these proactive measures we take and ensure that the outcome is good for the mother as well as for the baby. And finally, postnatal care is also important. It's before that, intranatal care. During delivery, we need to monitor these babies more intensely than the normal babies. Probably we put a continuous fetal monitoring for the baby during labor. And it's one more thing I would like to say, it doesn't mean that high risk pregnancies always land up with cesarean section. We can also give them normal deliveries, but maybe the incidence of cesarean section may be more in high risk pregnancies than in the low risk pregnancies. And postnatal care is also important. We need to see whether her sugars have come down, whether her hypertension has come down. All those things need to be seen. And mental health is also very important. So mental health, as I was telling you, high risk, those women who already have a mental health issue or history of mental health issue after previous delivery in the previous pregnancies, they also get classified as high risk pregnancies, and they need to be also monitored after delivery also.
Okay. So, what would be the take home message for anybody who is probably
Yeah,
experiencing
so a
high
high risk pregnancy is so defined not to scare the
risk?
patient. It is a alert both for the healthcare providers as well as for the patient to ensure that they go in for the care as advised by the healthcare provider. And for the healthcare provider, it is like keeping the mother as well as on the baby on our radar, and we're always alert looking for any other symptoms. And thirdly, pregnancy is a condition that needs to be enjoyed. So just because you're a high risk pregnancy, there is no need absolutely to be worried about it, because we know methods how to tackle the high risk pregnancy and how to ensure that there is the best outcome for any high risk pregnancy. So for high risk pregnant patients, when you have been classified as high risk, the only request is come back for checkup as often as your doctor asks you to. And if you've been asked to have frequent scans, don't worry, because a scan does not harm the baby. In fact, it gives us more information as to when to deliver the baby. And taking good care of a high risk pregnancy in a good facility always ensures that you go back home with a healthy, happy baby.
That's wonderful. These were wonderful insights on at risk or high risk pregnancies, and I'm sure a lot of information has been given, and I'm sure it's going to be very useful for our viewers watching this. Thank you so much, ma'am, for giving us that time.
Thank you.